We begin tonight with healthcare. The first question concerns Medicaid expansion and financially troubled Oconee Regional Medical Center. Now, Mr. Williams, you said you're in favor of Medicaid expansion and that it would help the hospital, but that would have to be done in a responsible way. What specifically do you mean by a responsible way?
Medicaid expansion was offered to all the states. Georgia did not accept it because it was more or less not mapped out as to what would happen. There was going to be a start date and an end date, and that end date is coming up. There's a lot of states who have gone through financial difficulties and financial times, tough times, and it's been very tough. I don't feel like the Medicare or Medicaid expansion is a hospital's problems. Our hospital's problems relates to jobs. When we had Central State Hospital here and 3,000 employees working for the state of Georgia, they had excellent health care benefits. Baldwin County Hospital, Oconee Regional Medical Center was prosperous at the time. What has happened to our hospital basically is the loss of jobs and the loss of benefits that those employers have had. The legislature had passed a law this past year that allows people to make contributions to a private hospital and lets those contributions be tax deductible. That works for communities of 35,000 or less. Baldwin County falls in the 50,000 population range. So the legislature is going to have to address that this next session and revise that law so that people can make contributions to the hospital and that contribution would be tax deductible.
All right, thank you very much, Mr. Williams. Mr. Griffin, moving now to you. You said you tirelessly lobby for Medicaid expansion. What hope do you have to get Medicaid expansion through a Republican-controlled legislature?
Well, I don't think that's going to be too difficult now because the Democratic House caucus has indicated that the Republicans are willing to work with the caucus to try to make that happen. Look, we have over 300,000 people in Georgia who do not have insurance. We have people dying every day because they are not getting the health care that they deserve and they need. Therefore, we need to have the Medicaid expansion to allow that to happen. And on top of that, it will help with jobs in our community. Now, this is the bottom line. Why would someone want to come to a business would want to come to Baldwin County? We're talking about an industry. If we have a poor health care system, and you aren't going to get the job. So Medicaid expansion will be one of my #1 priorities when I get to the legislature. It will help the failing hospitals. We've had over 5 hospitals in rural Georgia to have to go out of business because they did not have the resources, and part of their resources is from a Medicaid expansion. Now, the reason the Republican and the governor did not pass this is because of the Obamacare, the Affordable Care Act, and get them back to him. See, we are paying the tax dollars already. It's being taxed. And those dollars are now going to other states when we could be using those dollars here in Georgia. And I think it's a no-brainer. And that is something that we are going to fight very hard for in the next legislative session.
Mr. Williams, your chance to respond.
Yeah, casino gambling came up this last session. And it's been talked about, and it'll come up again this next session. And it's going to keep coming up. With casino gambling, MGM offered to write the state of Georgia a check for $500 million for 12 years, just to allow them to build a casino in Atlanta, Georgia. This would make Atlanta the #1 convention center in the United States. You can get on a jet anywhere and fly nonstop to Atlanta. If we put a casino in Atlanta, possibly one in Savannah on the coast, then the monies from that would go toward health care and education. That's what needs to happen. We're going to have to be creative and think outside the box. Last year, over 1 million people from Georgia visited Harrah's in Cherokee, North Carolina. People are going to gamble. They're going to go. We might as well capitalize on it here.
Mr. Griffin?
Well, what Rick is talking about is something hypothetical from the standpoint of the casino or the gambling piece. It could or could not happen. We are dealing with a crisis now with the Medicaid expansion, and all we have to do is accept the Medicaid extension, have those dollars coming into the community. I will deal with the casino situation issue when I get in the legislature if it comes up. I'm not going to be the person that's going to introduce that legislation because I think there are too many other important things that I would be dealing with. Now, there's a very good possibility I will support the casino legislation after I determine what's in the language of the bill.